Hi, it's Alex Zubarev for KCISU Primary Study Group. Today we will discuss compartmental pharmacokinetic models and kinetic of intravenous infusion.
Drugs do not distribute thoroughly throughout the body. Particular tissues may have a higher or lower concentration than the plasma. Some tissues, however, have similar drug concentration versus time profiles. It is then convenient to consider them as belonging to a common compartment. Compartmental pharmacokinetic models use the minimum number of compartments, usually 1 to 3, that can adequately describe the time course of drug disposition and predict the changes in concentrations that occur following drug administration. Compartmental models have no biological correlate. They are built by using mathematical expressions to fit experimental concentration over time data, and then adjusted for volumes and clearances. The one-compartment model contains a single volume and a single clearance. Although it may be appropriate to describe the kinetics of some drugs with large molecular weights that do not leave intravascular space, this model is not appropriate for the pharmacokinetics of small and lipophilic drugs. To build a better model for the concentration time curves of these drugs, clinical pharmacologists have developed two- and multi-compartmental models that can be presented as several tanks or compartments, connected by pipes. These models consist of one central compartment, correspondent to blood or plasma, and one or several peripheral or tissue compartments. Clearance, in which the drug is eliminated from the body, is referred to as central or elimination clearance. Clearances between the central and the peripheral compartments are referred to as intercompartmental clearances. Pharmacokinetic models can be used to predict plasma drug concentrations at different time points using mathematical equations. In the one-compartmental model with first-order elimination, the plasma drug concentration can be expressed using an equation with a single negative exponential term. The concentration versus time curve of the one-compartmental model represents an exponential decay curve, or, if plotted against a logarithmic scale, a straight line. In a two-compartmental model, the plasma concentration of a drug declines rapidly following intravenous bolus, with a rapid exponential phase that has time constant alpha. This rapid concentration drop is mainly caused by the redistribution of the drug into the peripheral compartment. Once the distribution has occurred, plasma concentration falls at a slower exponential rate, correspondent to the terminal elimination of the drug, with a time constant beta. The three-compartmental model is similar to the two-compartmental model, but with the addition of a third exponential decay process resulting from the presence of an additional compartment. The kinetic constant C and gamma describe that additional process. This model consists of the central compartment, into which a drug is injected, and from which excretion can occur. It is connected with two peripheral compartments, with which the drug is exchanged. The three-compartmental mathematical model can be expressed using a tri-exponential decay curve. This model most precisely represents the plasma concentration trend after a bolus of lipid-soluble drugs like propofol or fentanyl. After an intravenous bolus, the plasma concentration of these drugs follows a distinct similar pattern. exponential decline in three phases. Rapid equilibration between plasma and vascular-rich tissues, like skeletal muscles, followed by slow equilibration between plasma and fat-rich tissues. The final exponential decline is determined by the elimination of the drug from the body.
Pharmacokinetic models may appear as a complex topic to understand. You may ask, what is their clinical implication? Mathematical pharmacokinetic models have been used in clinical practice to predict and achieve specific plasma drug concentrations. For example, target-controlled infusion represents a technique of intravenous drug administration, where computer-controlled infusion pumps are used to achieve and maintain targeted plasma concentration or drug concentration in a specific body compartment. The technique is generally based on the three-compartmental model, adjusted for a specific patient's parameters like height, weight, age, gender, and others. It has been largely employed for controlling intravenous infusion of anesthetics, analgesics, and sedatives, since it is particularly suitable to quickly achieve and then maintain satisfactory degrees of anesthesia, analgesia, and sedation. However, in last years, the use of this technique has been extended to many other drugs, such as antiarrhythmics, anti-neoplastics, and antibiotics. At present, it has a limited but promising implication in intensive care. Another important implication of pharmacokinetic models is the ability by a clinician to understand better and predict the therapeutic effects of a drug following its bolus or continuous infusion. The terminal elimination half-life is a value often used for comparing the duration of action of different drugs, but it often has little clinical relevance because a rapid decrease of the concentration of the drugs in plasma and termination of their effect may be related to redistribution to peripheral compartments. It is also clear that extent of redistribution depends on the duration of intravenous infusion of the drug, and the time course for the decline in plasma concentration at the end of the infusion depends on the duration of the infusion. Context-sensitive half-time is the time required for a drug concentration to decrease to half of its value after a given duration of infusion of this drug. The context in this definition refers to the duration of infusion. It is important to understand that for many drugs, its context-sensitive half-time varies significantly with the duration of infusion due to redistribution and accumulation of the drug in some peripheral compartments. The following graph represents the context-sensitive half-time on the y-axis after cessation of infusion of given duration for fentanyl, sufentanil, alfentanil, and remifentanil. The duration of infusion is plotted on the x-axis. After a single bolus or a short intravenous infusion of up to 15 minutes, fentanyl and other synthetic opioid analogs have similar context-sensitive half-times. However, after prolonged infusion, such as longer than 1 hour, there is a marked difference among 4 synthetic opioid analogs. In contrast to its older congeners, remifentanil has a short and steady context-sensitive half-life of 3 minutes, which does not change with the increasing duration of infusion, whilst the context-sensitive half-life of fentanyl significantly increases. In general, the higher the ratio of distribution clearance to clearance due to elimination, the greater the range for context-sensitive half-time.